I'm going to go through some of these vitamins. I'm not going to go through every slide. I did talk about vitamin A a little bit. The dosage 5 to 100,000. Typically, people don't take much of it. If I'm going to use vitamin A as part of my super immune protocol, then I would give 50,000 units typically, 50, as the dose. That's the dosage I like. It's not toxic. I'm not using it every day. And even if you did, you could use a lot more than that before you would cause a fat-soluble toxicity. You know, my thing's not, oh, here it goes. It's like slow. Is it me? I don't know. Maybe me. Maybe I need another one. Anyway, requirements are increased. I think this is the important part of the slide with diabetics for sure, thyroid disease, and difficulty correcting the carotenoids to vitamin A. And there's a lot of people with hyperlipidemia that require increased dose of vitamin. Remember, vitamin A and D work together. And D is a big problem because, thank you so much, because it is one of those things that is so deficient in the American public now. It's pathetic. I do vitamin D levels on every one of my patients as part of the normal workup. And I can tell you, it is greater than 90% in Florida. I'm in a sunny part of Florida. So when someone says, oh, I haven't been out in the sun recently, I say, oh, okay. That it's so deficient, and you wonder why you have so much DNA breakage, so much DNA problems, chromosomes, heart disease, cancer, because it is the one substance, I don't know if you're aware of this, that can prevent 72% of the solid tumor cancers. Are you aware of that? There are 5 good studies that say that that is true, what I just told you. 72% of cancers can be prevented by vitamin D levels that are adequate in the high range. As a matter of fact, the studies also go on to show that vitamin D, if you already have the beginnings, as I showed you the marginal deficiency slide, till you have anatomic problems, if you're already on the road to a cancer, it still will prevent 42% of them. So if you're not putting patients on a vitamin D regimen, they should be part of your IV therapy and your oral therapy for sure. B1, of course, you're going to use often because of the fact that birth control pills and diuretics reduce this water-soluble vitamin, needs to be put in every day. You're going to use vitamin B in doses to 5 to 300. Typically, the vitamin B complexes that you're going to use together are 100 milligrams. They're going to have 100 milligrams in it, so you know how much. And of course, there's no toxicity from this. Case 8. True case, a case of just 2 weeks ago, maybe 3, not even. Brand new case of mine. An 18-year-old male has a history of severe migraine headaches since age 12. Comes and goes. He has had a hiatus of several years since the last headache. However, 3 weeks ago, prior to coming to see me, was admitted to the hospital for severe classical migraine with neurologic sequelae. It's a good case for you, Bill. Is Bill Hammesfahr still here? Did he walk out? He's not in right now. Okay. Severe. The hospital, of course, after neurology saw them, did CT scan, MRIs, EEGs. Everything's normal. Put him on, of course, a morphine drip, was released and enters your office on several analgesics, on PO analgesics, but still has debilitating headaches daily. His hospital workup was totally unremarkable. Nothing. What would you consider as a further workup? What treatment options would you pursue? Great question. Common case. Common case. This is what happened to my case, and then I let you answer while you're thinking. Kid came in, sat with his mother, an athlete, tennis player, and could hardly move. Horrible. 3 weeks of 4 neurologists, hospitalization, and saying, I don't know what to do. Why did he come to me? He actually came to me because one of the owners of the practice, this is his nephew. So I told him, bring him over. So as he came over to the office, I looked at them, listened to the story, and this is what I said. I know it sounds funky, but I said, don't worry. In 24 hours, this will be over for good. And of course, they smiled as if, you must be a nutball because we just saw all these doctors. And I said, in 24 hours, this is over. It actually was 12 hours. I was off by 12. In 12 hours, he was back to his normal activity. His headache completely abated. He hasn't had another headache since. And the family could not believe it. They said, again, how do you do what you do? I do because I apply physiological principles and think through a clinical situation. Now, Bill, this is a great case. I'm glad you're here. This is a case I just did 2 weeks ago, or a week ago. Kid with migraine, classical migraine with neurologic activity in the hospital, 4 neurologists, morphine drips, nothing positive. Got rid of his headache in 12 hours completely. How would you treat it? Think through it. You're all clinicians. Think. That's what I have to I'll help you with in this course. What would you do? Let me hear from a nurse practitioner first. What do you say, nurse practitioner? Magnesium. Magnesium? I like the choice. Good choice. I would thought that's good. Why? You're going to have to tell why, because I'm a patient. Why do you want to give me magnesium? You got to give me a reason. For vasodilation? Migraines are sometimes vasodilated. You need to constrict them. That's why they give them all these sumatriptan and things. I don't know if that's a good reason. It may make it worse. He was an athlete, but he's been out of working out for 3 weeks. He can't move. He's been in bed the whole day. Hasn't been in school, nothing. What are you going to do? How are you going to treat this? Nobody has any idea. What are you going to do with this patient? You're going to street him? What are you going to do? Send him to what? What are you going to do? Okay, go ahead. Get a shot of it.
Okay, I think he has oxidative stress from exercise, so I would give him B12. I had a go out. I would give him CoQ10. All the nutrients for the first cycle.
Okay. Would you do any other workup on him? Outside the classical workup the neurologist already did? Nothing? Okay. All right. You give him what? Check his iron and B12. Okay. That's a good thought. Give him some B complex, B6. Huh? Do some 24-hour for oxidative stress? Yeah, I would take that as an okay thing to do. I didn't think this was oxidative stress causing this, by the way. It was my opinion. But that's not a bad idea, by the way. It wasn't my opinion that's what was the problem. Allergic reaction? Okay, it could be. It could have been allergic reaction. Mitochondrial dysfunction. What would you do, Bill? You're the neurologist. I know, I put you on the spot, right? That's what this is all about anyway today. It's all right.
Well, I think the approach of start of use of magnesium is good when I do CT scan, and I use a lot of, in this age group, I'm very focused on cervical spinal injuries and various deficiencies like magnesium, so I do transcranial Dopplers and prior studies and of course MRIs.
Well, you're going to hear more about that. He's going to talk about that later. Anybody else have any other concept? I'll tell you how I treated this case. Exactly, I will tell you. Okay, that's one test that I did do. I did 2 tests, actually, on this kid. I don't even have the results back, and it was cured in 12 hours anyway. I hate that word. I forgot I'm not supposed to use that word. This is what I did. I did food allergy testing on him, because when I questioned him, I said, is there anything that you do when you eat that ever sets this off in the past? He said, yeah, when I eat gummy bears. Anything that's gummy. So I said, okay, there may be some food allergy etiology to it, so I did some food testing on him. I don't have the results of it yet, so I can't even tell you. That's how fresh this case is. I also did adrenal stress profile on him. He's a high-profile kid, A student, pushing to be, he just won a tennis scholarship to Bucknell. He's not a dumbass kid. He's a smart kid, under a lot of pressure. But how did I treat it? Tell you what I did. First, I started on 2 days in a row, because they came from far away. They came from 6 hours away. So I kept them in the area, which I told you I'd do. This case I treated 2 days in a row with a multi-mineral vitamin C because I felt that, A, there must be spasm and there must be some inflammatory component of that artery. It had to be. So I figured, because I'm banking on he's got a food allergy, but food allergy always causes inflammatory component. So I gave him a multi-mineral drip, which I'm teaching you. The exact one I gave, you'll have it. Gave it to him one day. Matter of fact, during that IV, he got some headache. Worsened. You know what I did? I caused a worsening that Bill tells you to be careful of. I worsened it because I moved a little too quick. Learn from my mistake. Because I probably caused some insufficiency. I backed off real quickly, slowed it down, made him stay for 3-4 hours, hydrated him. Next day, no problem. Tolerant of the vitamin C and all the multi-minerals. Overnight, what did I use? I started him on, I broke the pain cycle. Huge dose of the essential fatty acids, curcumin in a large dose, quercetin in a large dose, and I put him on a large dose of melatonin at bedtime. Guess what? His mother wanted to kiss me on the lips the next morning because the kid was completely better. Did I give him the next IV? Absolutely. She said, does he need it? I said, absolutely.